Good morning. I wish I could be there with you. You are on the front lines of providing preventive and clinical care and making sure that people stay healthy and get the care they need. You are also teaching those who will serve on the front lines of care. Public health nurses and clinical care providers used to work in isolation and frankly, for the most part, still do. But the Affordable Care Act means that now you need to work together. As both a provider of acute care services and then moving on to serve as a public health nurse, I've always thought that connecting these worlds would be a win-win for patients and communities alike. New care models like accountable care organizations, medical homes, and care transitions have the potential to provide better care at a lower cost, but only if you collaborate effectively. Our country needs your expertise and leadership. In fact, your leadership is more important than ever. And that's why the Robert Wood Johnson Foundation and AARP are leading the Future of Nursing Campaign for Action. We believe that nurses are vital to health system transformation. And our goal is to improve health through nursing. No one understands the culture of health better than nurses. The campaign is working to prepare the nursing field to address our nation's most pressing healthcare challenges: access, quality, and costs. And we're making sure that we care more efficiently and effectively for the growing number of older Americans with chronic conditions. We're making sure that our nation's healthcare system will be able to provide care to 32 million newly insured Americans. And we are also keenly aware of the value of prevention, health education, and surveillance activities in keeping populations healthy. Health and healthcare are not an either-or proposition. We need both to achieve the kind of morbidity and mortality rates that makes us envious of other countries. That's why our campaign is implementing the Institute of Medicine's landmark report on the future of nursing. The experts behind this report believe that nursing must be prepared for health system transformation, and nurses must help to lead and shape this change. Our campaign has launched action coalitions in all 50 states and the District of Columbia to pave the way for needed changes. We want to maximize the use of nurses and prepare nurses to meet the healthcare demands of today and tomorrow. The campaign includes a wide range of health providers, consumer advocates, policymakers, and the business, academic, and philanthropic communities, all the people who need to be involved in creating change. We're focusing on promoting nurse leadership, removing barriers to practice and care, strengthening education and training, promoting diversity, and fostering interprofessional collaboration. Because all of you are leaders, and because your leadership is so important, I'm going to stress leadership to you. The future of nursing starts with leadership. Nurses provide an important point of view in decision-making from the boardroom to our communities. Whether you work in acute care or in the community or in public health settings, I always say that nurses are the reality check. They know what is best for people and communities and need to be at more tables to say so. The Campaign for Action is working to prepare more nurses to help lead improvements in health system quality, safety, access, and value. And we're also working to get more nurses appointed to public and private boards. We need strong nurse leaders to articulate and demonstrate the impact of public health toward improving health outcomes. The bottom line is that nurses must see policy as something they can shape, and that's what you're doing today. Your feedback on the benefits, challenges, and opportunities for public health and healthcare collaboration, and your efforts to identify new areas of collaboration are sorely needed. I hope that you'll continue the discussion and dialogue with the CDC beyond today. I hope that you'll be leaders in integrating public health and clinical care, and I know you will be. And I hope that you'll continue to get involved in other leadership opportunities, especially with our Campaign for Action. For those of you who live and work in Georgia, we have a really terrific action coalition there. You can go to www.campaignforaction.org or to sign up and join the Georgia Action Coalition if you haven't already. Join us to improve care for people and populations and lead system change. Help shape the future of healthcare for all Americans. Thank you and have a great conference.